Hello students, this is Dr. Faizan Mirza. We are discussing ventilation-perfusion relationship. Ventilation refers to gas exchange and perfusion refers to blood flow. There are three mechanisms of hypoxia to be considered initially. Hypoxia means low PO2. So these could be because of hypoventilation or diffusion limitation or due to shunt. This mismatch of oxygen in blood, which could be because of ventilation or perfusion, this is important in various pathologies. There are four main causes of hypoxemia, which is low PO2 in blood supply, and these include hypoventilation, diffusion limitation, shunt, and ventilation perfusion ratio, which is unequal in various parts of the lungs. Transport of oxygen from air to tissues, it's all dependent on how much oxygen is there in the alveolar gas. How do we calculate this? We just subtract the vapor pressure of air in alveoli from the pressure of inspired air. PO2 in alveolus is balanced by removal of oxygen by the pulmonary capillaries, which take the oxygen away from lungs. This is a continuous process, as well as from inspiration, because of which we are constantly breathing in and breathing out, so gas exchange keeps occurring. Inspiration is the actual determinant of PO2 in alveoli. What is hypoventilation? Hypoventilation occurs when alveolar ventilation is low and PO2 falls. This alveolar ventilation being low could be because of paralysis of respiratory muscles, drugs usage such as morphine or barbiturates, high resistance for breathing, which is mainly during deep underwater diving. When PO2 level falls, this increases PCO2. PCO2 can be calculated by VCO2 divided by ventilation multiplied by a constant. So VCO2 is the carbon dioxide produced and VA is the alveolar ventilation. This effect of hypoventilation can be reversed by additional oxygen being inspired. Once PO2 returns to normal, the PCO2 returns as well. PCO2 returns faster to normal as compared to PO2. No, I mentioned it the other way around. PO2 returns faster as compared to PCO2, because PCO2 actually there are more reserves of PCO2 because of bicarbonate ion in blood and the body fluids. So PCO2 takes a longer time to return back to normal as compared to oxygen. What is shunt? Shunt means blood that enters arterial system without going through the ventilated parts of the lungs. The shunted blood can be from the bronchial artery, which is taking the blood from which delivers the oxygenated blood to the bronchi. From here, the blood goes to pulmonary vein and oxygen is partly depleted. Similar goes for Thebesian veins. Thebesian veins, they drain coronary venous blood into the left ventricles directly without the blood getting a chance to become oxygenated. So this poorly oxygenated blood then mixes with oxygenated blood in the left ventricle. Then AV fistula. AV fistula is an abnormal connection between small pulmonary arteries and veins. Shunted blood actually reduces PO2, and this is not affected by inhaling more oxygen. Why? You can just think of reasons. Similarly, shunt hypoxemia responds poorly to added inspiration of oxygen. Again, you can just reconsider this, why this is the case, as compared to what we just discussed in hypoventilation, because here when you inhale enough oxygen, the effects of hypoventilation can be reversed. But with shunted blood, inhaling in more oxygen cannot reverse the effects of shunted blood. Coming to ventilation perfusion ratio. Ventilation and blood flow is mismatched at various places in lungs. This impaired oxygen and carbon dioxide exchange is resulted eventually. This model here shows to you how a dye can be added to a system. Addition of a dye, a powdered dye, is then added to this region, and there is water flowing from the bottom, and there is a stirrer. So all the dye that you add is taken away by water, which is flowing from this direction to this direction as shown by the arrows, and the stirrer keeps rotating. This is a model used to describe how ventilation and perfusion goes hand in hand. Oxygen ventilation is depicted here by the addition of this dye. This is how you inhale and you keep adding oxygen to your lungs. In the alveoli, across the alveoli, you have blood supply, perfusion going on, so that blood flow takes oxygen away from the lungs. The ratio of ventilation to blood flow is called as the ventilation perfusion ratio. Ventilation is denoted by VA with a dot and perfusion by Q with a dot. So VA over Q, or ventilation perfusion ratio, this is how we depict it. When we are referring to ventilation perfusion ratio VA over Q is directly proportional to ventilation and inversely proportional to perfusion. Here in this diagram, we are discussing a line here. So this condition is that this is the region, this is normal. So if you go beyond normal to a value where oxygen depletes and carbon dioxide increases, we see that the ventilation perfusion ratio is decreasing. Whereas if you go beyond normal and you increase the oxygen concentration and CO2 drops, in this case, ventilation perfusion this ratio starts to increase. These three diagrams depict this condition. This is the normal state. In the normal state, you can see normal inspired air has oxygen is 150 millimeter mercury and carbon dioxide is 0. When it comes to the lungs, oxygen and carbon dioxide gets exchanged accordingly down the diffusion gradients, and proper ventilation and proper perfusion results in a normal value of ventilation perfusion ratio. But let's suppose if there is an obstruction here in the airways, and this cause obstruction, this obstruction results in ventilation becoming you can say compromised, whereas perfusion is normal. In this case, oxygen and carbon dioxide gradients start to suffer and the VA over Q ratio starts to decrease. Eventually an equilibrium is achieved at this end. Another case is when ventilation is normal but obstruction is there in the vessel. So this causes obstruction in the pulmonary region in the blood supply, so perfusion is limited. In this perfusion limitation, again this exchange starts to suffer because there is an obstruction in the blood flow. All the ventilation stays normal, so oxygen value increases where CO2 starts to just drop down. In this case, the VO over Q ratio, the ventilation perfusion ratio, starts to increase to an infinite value. This graph here shows you the relationship with PO2 increasing along the y-axis and how the ventilation perfusion ratio is changing. So the x-axis shows you increasing the amount of oxygen, and this y-axis shows you the PCO2, which is increasing carbon dioxide concentration accordingly. So if we place this on a line, we say this is the normal condition where V over Q ratio is normal. When you increase oxygen concentration, so the ratio starts to move to an infinite value. In this case, the obstruction is in the perfusion region, and if the equilibrium is reached, it means that you are decreasing the ventilation perfusion ratio to a value where the reason is the obstruction in the airways, where the perfusion stays normal. So this point represents the mixed venous point, and this point at the end, it represents the inspired point. The mixed venous point is represented by V with a bar, and inspired point is represented with I. This point here, A, is the end capillary blood, which is the normal condition where oxygen and carbon dioxide are getting exchanged normally. So right in the center at normal, we have A, and if we increase it, we go to an inspired point, which is I, and at a lower end, we come to a V bar, and this is all because of the ventilation perfusion ratio changing. This occurs when ventilation perfusion ratio decreases. This comes when ventilation perfusion ratio increases. The decrease in the ventilation perfusion ratio is because of the obstruction in the airways, and the ventilation perfusion ratio increases because there is an obstruction in the perfusion pathway. In both these instances, we have taken into consideration that one part is blocked. For example, here we can say that the airway is blocked, but the perfusion is normal. Here the perfusion is blocked and the airway ventilation is going normal. Regional differences exist all across lung. Ventilation, it increases from top to bottom in the lung slowly. So when we are discussing ventilation, we see that it increases from top to bottom slowly, whereas perfusion, it increases from top to bottom rapidly. This results in ventilation perfusion ratio decreasing down the lung. This you can see here in the graph. This graph represents to you the volume of lungs on this axis. This represents to you the rib number from bottom to top, and this represents the ventilation perfusion ratio. A low ventilation perfusion ratio is found at the top, and a high ventilation perfusion ratio is found at the bottom. You can see that how not this bottom, this is the bottom. So you can see that how ventilation perfusion ratio, this line actually is changing, and how blood flow changes all along. So ventilation increase and perfusion increase top to bottom. This is the case of your lungs. This is the apex of the lung. This is the base of the lung. These are the various regions in the lungs where we see a ventilation perfusion ratio being mismatched, and this is how it actually follows. Here you can see that various points within the lungs are falling on one point or the other on the line. This is the normal, and this is we are going higher to the inspired point where ventilation perfusion ratio is increasing. So as you come from the apex to the base, we see that the ratio of ventilation perfusion keeps decreasing. So at the top you have a high ventilation perfusion ratio, and so on and so forth. It keeps decreasing to normal by the time you come to the base. This change in the ventilation perfusion ratio decreasing down the lung is because the ventilation and perfusion are not following the same order. The ventilation here is increasing or decreasing, and perfusion is also increasing or decreasing, but the change occurring is more rapid with perfusion than with ventilation. Here in this diagram, you can see this is the top region of the lungs, and this is the bottom region of the lungs, and you can see this graph here shows you the regional comparison of how these all variables are changing all along. So if we just see how these variables are changing, the volume, ventilation, perfusion, the ratio, the PO2, PCO2, nitrogen, oxygen, carbon dioxide, pH, oxygen in, carbon dioxide out, what do we see? We see that volume increases, ventilation increases, and perfusion increases even more. So the value is higher, the rise is higher. You can just compare the values from here. For example, you can see the value of Q becoming from 0.7 to 1.29. This is a very high increase, whereas this increase in ventilation was 0.24 to 0.82. So their rise was there, but this increased even further. Whereas ventilation perfusion ratio, it decreases, PO2 decreases, PCO2 increases, nitrogen increases, oxygen decreases, CO2 increases, pH decreases, oxygen in and carbon dioxide out increases as well. Always keep in mind that carbon dioxide and pH, they follow a reverse order. If CO2 is increasing, pH is decreasing, because carbon dioxide is an acidic gas. You can just compare the values one against the other from top to bottom to see how I figured out these all changes. This mismatch can be seen here. This is the apex and this is the base of the lungs. You can see that at the apex, their ventilation is high and the perfusion is low. The ventilation is high and the perfusion is low, and at the base, ventilation is low and the perfusion is high. So this results in the mismatch, and there is a decreased arterial PO2 due to ventilation perfusion inequality, because most of the blood comes from the poorly oxygenated base, and this depresses the blood PO2, and this is inevitable. So this mismatch can be seen here. So that's the main point regarding ventilation perfusion ratio. That's it from my side. Thank you so much.